you may know and may remember that the first grand rounds of the year is basically mine to invite or host or present, and I use it as an opportunity to highlight something that I think is very important to the missions that we pursue on a daily basis, and maybe something that's a little bit outside of our normal work scope or our normal, we'll call it power groove. So we're going to be endeavoring to maybe expand your field of appreciation. So last year we focused on empathy, and this year we're focusing on compassionate schools and compassionate children and how we promote that. And so it is my great pleasure to introduce two friends and colleagues and co-investigators with me, both of whom are very distinguished faculty at UVA, but not in the health system. And so, and there are two of them. The first is Professor Tish Jennings. Tish is an internationally recognized leader in the fields of social and emotional learning and mindfulness in education. And she is professor of education at the Curry School of Education and Human Development at the University of Virginia. Her research places a specific emphasis on teacher stress and how it impacts the social and emotional context of the classroom. Professor Jennings has led the team that developed CARE, C-A-R-E, a mindfulness-based professional development program shown to significantly improve teacher well-being, classroom interactions, and student engagement. She is co-author of Flourish, the Compassionate Schools Project Curriculum, an integrated health and physical education program, and she is co-investigator on a large randomized controlled trial to evaluate the curriculum's efficacy. She is a member of the National Academy of Sciences Committee on Fostering Healthy Mental, Emotional, and Behavioral Development among Children and Youth. She was awarded the Kathy Kerr Award for Courageous and Compassionate Science by the Mind and Life Institute in 2018, and recently was recognized by Mindful Magazine as one of 10 mindfulness researchers you should know, and you should know them. Earlier in her career, Jennings spent more than 22 years as a teacher, a school director, and a teacher educator. She is the author of numerous peer-reviewed journal articles and chapters and several books. And I'm going to tell you that we will have all of her books available in the Kessler Library, the Department of Pediatrics, for all of you to come and peruse and borrow and read. And I've read several of her books, and they are awesome. Professor David Germano, PhD, is professor of Tibetan and Buddhist Studies at the University of Virginia, and he is the director of UVA's Tibet Center and the Contemplative Sciences Center, and Shanti, which stands for Sciences, Humanities, and the Arts Network of Technological Initiatives. He is trained as a scholar of Buddhist studies, Asian studies, and religious studies. Professor Germano has written extensively on Tibetan Buddhist thought and contemplative practice. In addition, he has an extensive background in working on digital technology in academic contexts, as well as engaged academic initiatives in Tibet and Bhutan. He also, by the way, offers a Coursera course on Buddhism, which I and I have both taken, which is awesome. Since 2011, Professor Germano has worked extensively with each of the 12 schools at UVA to explore learning, research, and engagement initiatives regarding how educational systems can better foster student flourishing in all aspects of the educational process. He also has been involved with new models of research on contemplative practices, and especially how diverse cultural contexts influence the impact that contemplation has on one's body, mind, and relationships. It is my great pleasure to welcome Professors Jennings and Germano to Pediatric Grand Rounds this morning. Please take it away. Who's first?
Okay, I'm first, David.
Okay,
so
David.
Thanks so much, Jim, for that gracious introduction and the opportunity to talk to you all today. So we're going to start with a reality that I'm sure you're all very well aware of, namely that we're experiencing a crisis of well-being amongst our youth. And we find this across multiple indicators of well-being, exponentially raising degradation of well-being amongst our children. Stress, depression, anxiety, loneliness, disconnection, isolation, suicide, bullying, pharmaceutical regulation of attention and emotions. Now, the drivers of this crisis are debatable, but research studies point to some obvious culprits. On the one hand, digital technology on multiple levels, the way that our children's attention is being commodified by large technical and marketing firms to make them into predictable commodities that can be bought and sold on the market with zero concern for the well-being of our children. Judgmental social media, distraction of attention. Also, studies point to the environment and climate change crisis, racial and socioeconomic inequity, school shootings, terrorism, and then also just relentless change in all sectors, change which is increasing in pace and scope and complexity and ubiquity on every front we can see, economic, social, technological, and so forth, to the point that change is becoming toxic for our children. It's outstripping their individual and communal capacity for adaptive flexibility and for allostatic health. And so the need in the face of this crisis is that we have an urgent need to get outside of the box and begin to rethink public schools in pre-K through 12 education to try to find new methods that holistically address student suffering and facilitate student flourishing. And what we need is highly experiential solutions, not didactic ones that help students foster the skills and dispositions that will lead to success in school and life. Practices such as fostering our capacity to focus, to regulate, to be calm, to be resilient in the face of stress and uncertainty, to be caring, to be empathetic, and so forth. And the model that we're embracing is the kind of two continua model of mental well-being that's been articulated by Corey Keyes that recognizes the existence of a continua that goes from the presence to the absence of illness and a separate continuum that goes from languish to flourishing. And so the idea is that emotional, psychological, physical, social well-being for our children requires that they actively cultivate flourishing as a positive, dynamic, flexible, and adaptive capacity beyond the mere absence of illness and certainly beyond the mere the capacity to downregulate. We need practices and exercises that cultivate what Peter Sterling has characterized as an allostatic model of health, rather than merely aspiring to homeostasis. And the other fundamental idea is that the best prevention strategy is, of course, a promotion strategy, to cultivate flourishing as a positive dimension instead of being complacent with languishing and the mere absence of illness. And so the question that we start with today is, how can a partnership between two different initiatives at UVA, the Compassionate School Project and the Pediatric Clinical Integrated Network, lead to transformation in local school networks here in Charlottesville, as well as groundbreaking research that could support these changes eventually happening elsewhere?
So an overarching answer is to transform the institutions and overcome the barriers to student flourishing. And we can do this if we think about these obstacles that David outlined in particular, but then also how might we transform these systems or institutions to promote flourishing and well-being. First of all, I don't know how many of you are familiar with the PE curriculum in the United States, but it's very antiquated. And they're doing the same things that they have been doing in PE since I was a little kid, which was a long time ago. And so part of the process of building this curriculum is looking at what do we now know about how we can learn to recognize our own needs physically and take care of ourselves better. We call that somatic literacy. Then the other thing is we know that stress is on the increase and it's impacting schools, and it's been impacting schools for a while. But teachers and students are not taught any skills for managing stress, and the systems themselves are imposing additional stress on a regular basis. So helping individuals manage the stress, but also helping the institutions understand that the stress is impacting the learning of the individuals in the environment and the teaching can make a big difference. So the curriculum builds in this understanding into the whole school system. There's also a problem with social disconnection and loneliness. That's another growing problem. So part of the social emotional learning aspect of this curriculum is helping kids learn how to get along with one another, how to understand other people's perspectives, and recognize their own emotional experiences and how they impact their interactions with other people. obesity and diet is a big problem today in young people, and the curriculum introduces nutrition. And we looked at what was most effective in terms of nutrition education, and I will be talking a little bit more about that in a few minutes. But it's not the whole plate idea that we're used to. There's more evidence that shows that children learn about eating skills in a different way, which I will talk about. Also, there's a disconnect in health education, because often it's very didactic and it doesn't include explorations of how one's body feels under different situations. So this experience of how to not only recognize how you're feeling, but cultivate certain experience states intentionally, like compassion, becomes part of the answer, the solution. Scaling this kind of education intervention, you need to key the curricular interventions to the situation. It has to be context integrated. And then one thing that's become very clear to us is that there are additional severe challenges for students from diverse backgrounds. And when we developed this curriculum, we thought a lot about equity, diversity, and inclusion, because the social emotional skills that we learn are very dependent on our culture and our upbringing, and being sensitive to that and understanding that is part of a good equity-based social emotional learning program. Another area that I'm very interested in is childhood trauma, and how can schools build in trauma-sensitive practices that can help kids recover from trauma and become more resilient. The other thing that we really need is research to base our policy on. And so the research that we've been doing on this project will help us see, in this scale, at a school scale, can we actually transform kids' understanding of their own well-being and health. And the other thing is, there's been a disconnect between public health and education for a long time. And we feel like this is a really great first step to start bringing those two together to address the needs of the children in our community.
So against this background, I'm going to give a kind of short history and also projection into the future of what the Compassionate Schools Project has been doing. So we kind of took into account this crisis of well-being amongst our youth, this intimidating array of institutional barriers to how we can mobilize this immense investment we make in public education to better address the crisis. And about a decade ago, the University of Virginia considered these things, and this led to the founding of the Compassionate Schools Project. So the first point, over on the left-hand side, a landmark curriculum. We didn't start with the idea we're going to build a curriculum. Tish and I first, kind of along with some others, surveyed the field, like what was going on, what were people doing, was there a curriculum that we could take and we could use for the purposes of doing these implementation and research studies. And social emotional learning, of course, is the kind of grandfather or grandmother of these approaches. It's been going on for several decades now. It's increasingly well accepted. Yoga in the schools and mindfulness in the schools, much more recent. But what we found as we kind of looked at these different solutions is that they all claim to incorporate each other or integrate each other. But the reality that we were finding was they were each quite different in character. Social emotional learning didn't take into account these kind of physical practices and these attentional practices. The yoga in the schools programs, which is the kind of word that they use to refer to each other, they would talk about mindfulness or contemplation, but in reality, it was more saying, hey, we're going to do the yoga and we'll accomplish these other things along the way, whether social emotional learning outcomes or mindfulness outcomes. And similarly, mindfulness in school programs constituted a kind of silo where they would talk about mindful movements, but they also weren't really that serious for the most part about social emotional learning or alternatives to physical education. So after doing this survey and not finding a kind of curriculum that brought all three of these together into a powerful whole, we decided to build a curriculum that did precisely that, that kind of took these two traditional pedagogy, meditative or mindfulness approaches, yoga, body awareness, and discipline approaches, and brought them together with a powerful social emotional curriculum that created a deeply integrated whole. The other aspect of the curriculum that we wanted to focus on was grounding it in the realities of public school education. We know how to do these things often in private school contexts, like look at Waldorf or Montessori or a variety of other private schools. That's not the problem. The problem is, how do we do it in public schools? How do we do it in public schools in a way that can be tractable, that can scale across this profoundly diverse environment across this country with different school regulations and the curricular needs that they spawn and embrace? So we built something that was integrated first, because school systems are never going to be able to implement multiple distinct programs in these different domains, whether SEL or yoga or mindfulness and so forth. We also tried to focus on subjects that are required to teach, how to meet state and federal guidelines. We wanted to rely upon credentialed teachers that were already present in the school system. We wanted to do something that was teacher-friendly, easy to implement, and so forth. So we really designed it from the start with this in mind. And then secondly, against that background, we created a partnership with a city between the University of Virginia and the city of Louisville in Kentucky, which has one of the 30 largest school districts in the country. So we created a partnership locally with powerful families there, particularly the Brown family, which was instrumental in helping raise the money and galvanize public interest. Philanthropic organizations in Louisville, the mayor's office, the school district, really a kind of comprehensive relationship across these different stakeholders in the city. And one of the outcomes of that is that the city is actually now continuing the curricular work beyond the research-funded intervention, which is highly unusual in character. And so what we've done over the past number of years is an RCT-based research program of unprecedented scale and rigor for this kind of program. 20,000 kids across 45 schools, multiple measures. We'll come back to that in a little while. Number three, what we're at right now is we're finishing up the Louisville program, another year or two to go there to just wrap up the analysis of data and writing up research results and so forth. And we're now revising the curriculum based upon 5 years of research and experience. And we're also looking at beginning to respond to the considerable interest around the nation in taking up this curriculum in other communal settings. And so against that backdrop, we are focused in the past year and going forward on how to bring it back home here to where we live in Charlottesville and Albemarle County school districts. And so last year, with the support of a 3 Cavaliers grant, Jim and Tish and I put together a program to pilot CSP in the Charlottesville school system at Johnson Elementary. We'll return to that topic. And we're partnering also with UVA's Pediatric Clinical Integrated Network to try to do new forms of research that go beyond what we were able to accomplish in Louisville.
There's 4 elements to this curriculum, which I've briefly talked about already in a sense. There's social emotional learning, this understanding of how we interact with others and how our emotions affect that. The contemplative practices, mindful awareness practices and compassion practices, mindful movement that helps develop body awareness, balance, and then nutrition education, which I will talk a little bit more about in a few minutes. So a little bit more about social emotional learning. There are 5 core elements that have been identified in the social emotional learning world. They are self-awareness, which is the ability to notice your own feelings, your own bodily sensations, your thoughts, and to understand your strengths and weaknesses, and also your values. Self-management is, how do I manage my own behavior and my own attention and my own interactions with others in a way that meets my goals? And then social awareness is, what's going on socially around me? How do I fit into the social world? And how do I understand other people's views of the situation? And then relationship skills are, how do I build strong, supportive relationships with other people? And responsible decision-making in a way is a culmination of all of these. If I have these 4 skills, then I'm more able to make decisions that take into account all these different perspectives and needs. And as I mentioned earlier, these core elements that I just described all differ by culture, ability, and inclination. So a good SEL program needs to take that into account. Okay, David.
Okay, then the second strand, and keeping in mind, as Tish said, that these are really strands. They're strands from which the curriculum is interwoven, so that they're all interconnected with each other and mutually reinforcing each other. So contemplative practices. So contemplation is a term that we use a lot, not in the K-12 program directly with students, but rather here at University of Virginia. Of course, I direct the Contemplative Science Center. And the way we start with the notion of contemplation is a very standard everyday use of the term, that it's this kind of gap between a situation and how we react to that situation. And so we're trying to help students introduce that gap, that small pause that might be just a couple of seconds or 10 seconds, but a pause in which they can begin to be intentional about the activities they're engaged in. And we're trying to help them learn practices that can help them create that gap and also explore it and help them align their behavior with their kind of values. And so the curriculum really integrates two different traditions in contemplative pedagogy, as I mentioned. And the first one here is mindful awareness and compassion practices. So the first one is just to help the kids learn practices that can experiment with what are the kinds of awareness that are available to them. Not just how to focus, although that's an important lesson, but also how to have open awareness, awareness that's open to the full visual or other kind of sensorial fields, and somatic awareness, awareness of our own body versus social awareness, awareness of others, and learning not just the different kinds of awareness they have available to them, but which kind of awareness is appropriate to which situation, and how can they deploy it in an adaptive manner. And then also we include under this category compassion exercises, exercises that help them acquire the capacity for social empathy, but also for a kind of evolving critical understanding of a situation. They can connect with that empathy and an inclination to act upon it and to reach out and to actively care for others. And then the other kind of strand of contemplative pedagogy is mindful movements or movements, somatic awareness. And so the idea here is that we want the kids to be able to learn about their bodies, proprioception, interoception, flexibility, balance, but how their bodies interact with other dimensions of their life. So they can begin to recognize when I feel this way, this kind of social situation is appearing. And so one way that we've thought about this is in terms of like doing a body scan, basic contemplative practice where you bring your awareness systematically through different parts of your body's interior and begin to create a space in your awareness of what that part of the body feels like, so that you're increasingly aware of your body as you go through the day, as you encounter different people, feel different emotions, and so forth. And they can take that interoceptive awareness and begin to apply it to concrete lessons. An example of this is Lisa Feldman Barrett's recent work on emotions, where she talks about the emotional circumflex and the way that affect, which for her is these kind of bodily sensations we feel, get translated into emotions. And so in this way, if you have somatic literacy, if you're literate on how your body feels, or you interpret it and evolve it into an emotion and then act upon it, you can begin to have an understanding of the way that emotions are kind of configured to your life history, to your cultural history, and that they can be interpreted in different. The first step to that is being able to be aware of your body and bring that awareness of your body into connection with the emotional outcomes that you're interpreting. So like with these kids, we might talk about the very well-known phenomena of being hangry, but there's many different forms of how hunger can translate into other kinds of emotions. And so this is another notion of Lisa Feldman Barrett, emotional granularity, that you can take a given emotion and by naming it and differentiating the physical affect and the emotion that's interpreted in our minds, we can begin to understand the context in which these emotions arise. So this is what this is about. It's about balance, it's about flexibility, but it's also about kind of developing this awareness of your body, your breathing, your movement, and how it relates to your emotional life, your social life, and so forth.
So in a way, you can think about this as health literacy that kids can learn at a very early age. And part of this is nutrition education. And we know from the research that really learning eating competence is what kids need to learn. The plate, learning about different kinds of food and the food groups and all that has never been found to be effective in terms of helping kids and their eating. But eating competence is learning more about how does my body feel when I eat certain things and how much and at what time. So over time, kids can learn through their own awareness of themselves how much they need to eat, when they need to eat, and what they need to eat. And the curriculum helps them explore those questions so that they can become good consumers, literally, of food. And this helps them make this connection between this somatic awareness and what they're eating or drinking, because part of it's also understanding whether they're hydrated or dehydrated or hungry, or what kind of hungry, and how hunger can connect with emotional experience. Do I want to eat because I'm feeling emotionally stressed, or am I really hungry? Okay, David. So, and the curriculum is designed to cover a whole entire school year. And you can see how it's laid out here in terms of the different elements and the different lessons that the kids learn over the course of a school year. It's broken down into three levels: the K1, the 2-3, and the 4-5. And some of the curriculum is repeated, but at a higher level in the next year. So we call it an education, a spiral curriculum. It repeats, but it increases in complexity and understanding, so they can refine their understanding over time. Okay. A really critical aspect of the Compassionate Schools Project is teacher support. And this has been one of the areas of my primary research, because we now know from much research that teachers are under a great deal of stress, particularly right now with COVID. And for them to be able to teach these skills to students, they need to embody them themselves. So we need to help them by giving them the skills they need. And part of that involves some of the trainings that I have been developing with my colleagues, to professional development trainings like the CARE program, which stands for Cultivating Awareness and Resilience in Education, and another program called CALM that is a more in place, more yoga oriented program for teachers to help them develop their own self-care skills and their own social emotional skills, so that they can be good models of this. Because in this kind of learning, the teacher is actually part of the curriculum. It's not something that they can separate from themselves. Okay. This whole curriculum, when we first started working on it, we realized that it aligns with something called the whole school, whole community, and whole child education model that was developed by the CDC and in partnership with the ASCD, which is an education organization. And in a way, this is a cutting edge. It is a cutting edge approach to child health and well-being, because we now know that health and learning you can't separate them. They go together. And we also know from systems research that the whole community is where we have to intervene. We can work at individual child levels here and there, but if we really want to transform our society in a big way, we have to look at the whole system. So we have to address the whole public school system and really think about how can the whole school promote well-being of the students in this school. And how can we integrate these skills into the everyday learning of kids? So it's not just PE and health. It is woven into as strands through the whole curriculum. And in this sense, that all the teachers, all the people, all the adults and children in the community become familiar with the vocabulary, they become familiar with the tools and the skills. And so when situations arise, they can draw upon those to teach in the moment these skills when they happen. So for example, if there's a conflict between students in a situation, any adult will be able to help them notice how they're feeling, start recognizing what happened, and be able to communicate with each other in a way that can peacefully resolve that conflict. And as a process, this brings everybody in the community together in a way that can foster well-being, because we now know also that when you feel connected to a community that values you, it's really important for human beings. And so the more a school can build this sense of community, the better off everyone in this community will be. Okay.
So against that background of this curriculum that we've developed, the original project was a 5-year randomized control trial, which was looking at the impact of this curriculum as implemented in K-5 classrooms in Louisville, Kentucky. And this has been the most comprehensive study ever undertaken of the 21st century health and wellness curriculum that integrates these various factors. It involved 45 elementary schools, 20,000 students, very broad demographic, geographic, economic diversity. We collected data across multiple school and student level dimensions, and I'll mention in a moment. And since we did this across an entire school system, the research has helped us understand the impact upon students and schools in very diverse circumstances. And so the 8 different things that we've been measuring in the course of the research study, which is now, this is the coming year, is the last year of the follow-up data acquisition. So we'll begin to be publishing results by the end of 2021. So the 8 things we're measuring, first of all, do students gain in these things we've been talking about? Social emotional skills, the ability to use mindfulness and body posture for focus, emotional control. Do they gain in knowledge about healthy eating and self-care skills? Do they gain on what the curriculum is teaching? Do behavioral neuropsychological surveys show that students improve in these skills? Number 2, do we see improved classroom behavior in their other classes? Are they on task more? Is there less disruptive behavior? Are they more engaged in learning? Are they better able to sustain focus, more engaged in learning? Number 3, classroom environment. Is it more calmer, less disrupted? Is it a better climate? Number 4, do the classroom teachers, not the teachers of the Compassionate School Project curriculum, but the other teachers, do they view their class as calmer, more engaged, and are they more motivated and satisfied as teachers? Number 5, do the schools where CSP is implemented show fewer discipline problems, better academic performance, and fewer absences? Number 6, are the effects that we see related to the fidelity with which the CSP teachers implement the curriculum? How important is that factor? Number 7, do the effects vary by student gender, grade, ethnic group, school ethnic diversity, the relative poverty status of the school? And finally, number 8, does the effect last beyond the years of direct exposure? Do students show improvement in the 2 years of follow-up data that we're collecting? And so what we're doing now is we'd like to bring it back home here from Louisville, Kentucky, to a partnership between UVA and the city of Charlottesville and the county of Albemarle. And so we began last year, Jim and Tish and I, with the support of a 3 Cavaliers grant from the University of Virginia, with Johnson Elementary School. It's a Title I school, so you have a high degree of poverty, a lot of Medicare-supported kids. Also, it's a school that has a history of being open to mindfulness and compassion activities. And so we began that pilot last year with K through 1, and this year we're continuing it with K through 2, and we're also beginning to explore the outcome measures that are being generated by the CIN. So last year we didn't really collect data, but rather as we were doing the pilot in Johnson Elementary, we were also working out the clinical integrated network so we could track kids by school. And so now we have a drop-down menu in EPIC where you can choose the school, and nurses are populating that field so that we can capture the school and grade for every patient who comes to us. And so we're going to continue this year to expand it, like Tish was talking about, across the whole school, not just limited to a single curricular intervention. And the goal is for us to expand and diversify across the Charlottesville school system and hopefully into Albemarle eventually in the coming years. And fundraising remains a kind of compelling issue for us. We haven't completely secured funding for this year, and a lot more funding will be required to expand this. And so we're looking to try to implement the same model we did in Louisville, where we partnered with prominent families, philanthropic organizations, and so forth. And so the partnership here between this Compassionate Schools Project and the Clinical Integrated Network, the real point of this is the value. The value is something that we're strongly committed to, which is, research programs are essential because they help us know what works and what doesn't work. The field is littered by things that everybody thought would certainly work, and they turned out to do damage to children rather than good to children. So we need to have research to really know with confidence that this kind of intervention with this particular cast is having this impact. It's also obviously important, as you know, for informing public health policy and practices. And so we're joining forces to try to do a kind of next level of research, something that goes beyond Louisville, as big and complex and comprehensive as it was. And in particular, we want to focus on the social determinants of health and the true cost of our educational decisions, so that when policymakers are deciding how and when to invest money into our public school systems, they're really calculating the cost of those decisions. In other words, if we take this kind of curriculum and implement it, it has these kinds of impact on children's health and consequently the economic cost of that healthcare, then even if you don't care about the kinds of things we've been talking about, just purely on the basis of the economics, policymakers may want to invest in these kinds of programs. And so also building resiliency to try to help build resiliency in students and their communities around Charlottesville, lower incidences of disorders, the need for expensive health costs, and have a better focus of researchers. And finally, our hope is that these effects can be tractable with these practices that are introduced by the Compassionate Schools Project. And in combination with the Clinical Integrated Network, it can serve as a model for how we can do integrated healthcare for population improvement in relationship to education.
So we thought we would end with an example of some of the core practices that we teach the kids. And if you have kids yourself, or if you've spent time with children, which I'm imagining you do since you're pediatricians, think about how often we tell our students or our children to calm down and pay attention, but we don't teach them how. So one of the core practices in the CSP curriculum is what we call calming and focusing. And to calm down is a very simple practice. We teach children to put their hands on their chest and their abdomen so they can feel their torso with their hands, but also the practice is to notice the sensation of the air as it's going in and out of your body while you take 3 deep, mindful breaths. So I encourage you right now to take a moment to sit up nice and tall. If you want, you can close your eyes. And at your own pace, take 3 slow, deep belly breaths. And then allowing yourself to settle into your normal breath when you've completed the 3 breaths. And then check in and just notice how you're feeling right now. We teach the children that when we put our hands on our chest and our abdomen, we call them anchor points because they help them anchor or steady themselves when they need to calm down. And we know that when you take 3 slow breaths like that, your autonomic nervous system, it settles in a way that helps you be more present with what's happening and not so reactive. Focusing is another really simple practice. We use a chime and we teach the children to listen to the chime, to focus their attention on the sound of the chime. And what we do at the very beginning of any lesson is we do the calming and focusing first, and we tell them, we're going to ring the bell, and when you stop hearing the sound, open your eyes and look at me. And then we have calm, attentive students looking at us. So I will ring this bell. I'm not sure how the sound will work on WebEx, but just you can close your eyes and just listen to the sound. And when you stop hearing it is the time when the practice is over. These practices are taught to all the teachers in the school so that it becomes part of the norm, that this is what calming and focusing is, and why it's important to learning. So that's a pretty key part of the whole curriculum. So I guess we have some time for some questions.
Yeah, I think we're turning it over to Jim.
Thank you. So I'm just going to pick up this thread and talk a little about our project and how it affects the pediatricians on the line. So I like big, hairy, audacious challenges, and this is the biggest, hairiest, and most audacious I think I've tried to undertake. But we come to work every day to help make kids healthier and keep them healthy and give them healthy, happy lives, et cetera, et cetera. And my pediatricians don't get a chance to. They don't get the time to do that. And thinking about in primary care, it's enough to give them the vaccines and do some screening stuff, but this sort of holistic approach is just not part of what the health insurance payers are paying for, unfortunately, but it should be. And similarly, the schools are often challenged just to, pursue the most basic curriculum with these kids and maybe keep order in the classroom. So somebody somewhere has to be responsible for the holistic approach and, the wellness of the child. And you two are pioneers, visionaries in this field, saying that we can integrate it into the schools and not just focus on keeping order in the classroom and on the curriculum and yada yada yada. And it's going to make the whole child better. And we should see that reflected when they come for healthcare to their pediatrician at UVA or somewhere else. So we got this crazy idea that we were going to break down these silos, and you were going to intervene in the classroom, and then we could use the clinically integrated network and the electronic health record, EPIC, and actually follow health-related outcomes to see whether the Contemplative Schools project was improving health-related outcomes that we captured in the clinic. And then, of course, we were going to use the CTSA, iThrive, and its Trinetics capability to mine EPIC. So really breaking down all these huge silos at UVA. But now we learned that silos exist for a reason, and they're hard to break down because people actually love them. And so breaking them down is actually hard. And probably the hardest thing was actually hammering on the electronic medical record. So I want to give a shout out to Martha Helms, who actually helped us to get, I shouldn't say helped us, but helped to get the school fields populated into EPIC. So now we can do this. And the CIN, Fortify, can mine data for the improvement of health without individual informed consent, right? If you're looking at health related outcomes at the population level, and so and you can use electronic medical record to do all of that. So we are now at the point where we can do this, and I'm hoping that people on the line are seeing the fields for capturing the schools. And Laura Schaefer and Ellen Davis have volunteered to join this team to help with this, and it's a big and growing team. But yeah, we're going to need buy-in from a lot of people to do this. I think it's really vitally important for the welfare of the kids. I think the last thing I'll say is that Dan Carey, the Secretary of Health for Virginia, when he became Secretary of Health about 2 years ago, he came to UVA to talk to a bunch of us, and he sat with me to talk about children's issues. And I spoke about a few things, and this project was one of the things that I highlighted. And he was quite intrigued, and he said, Jim, if you can intervene at the schools and you can impact health-related outcomes, whether it's attention deficit disorder or anxiety or whatever it is, health-related outcome that you can actually follow, and if you can demonstrate an impact, we will introduce the Compassionate Schools Project into every school in the Commonwealth of Virginia. So galvanized by the energy of Dr. Carey, we said, well, not only do we have to get on this, and not only is it important, and we could impact an awful lot of kids if we can actually show statistical significance on some outcome, but we better do it while Dr. Carey is still the Secretary of Health. So yeah, so the time is now, and And I think my faculty will be hearing a lot more about this, and we will be, we'll keep them abreast of how things are going with capturing the data. Tish and David, anything else to say about that?
I guess the only thing that I would add is that one of the reasons we chose Johnson Elementary, not only because it's a Title I school, which means it's high poverty, but we felt that the kids at that school are probably in most need of this kind of support. And what we will do eventually, once we have these data, is look at comparable schools and be able to compare them, see whether or not the CSP is moving any needles on any of these health outcomes that Jim was describing.
Tish, I just wanted to alert you to there being a questions and answers that you have to look at.
Oh yeah, yeah. I'm going to read that right now. I had actually, I've been looking at the chat box. So, if I can start on this. So, first question is that my understanding is that Black students are disproportionately disciplined in schools. Are you looking in your study at are you looking at this in your study related to behavior and discipline?
This is a really good question, and my lab at UVA is focusing on this question. We can look at this. One of the problems in the research I've been doing is a lot of the schools that I've been working in here, and I've been doing research in Louisville and Chicago and New York. They're very segregated. And this school is somewhat segregated too. So that makes it difficult. You need to have a pretty diverse group of kids in a classroom to actually study this empirically. But it is an issue that we are working on, because one of the hypotheses that we've been developing is there is some evidence that mindfulness-based practices help people recognize their implicit biases, and that there might be a way to develop a professional development program for teachers to help them manage their implicit biases and reduce implicit bias in the discipline process. So it is something we're working on. I'm not sure we'll be able to address it here in this project, though.
Okay. And then we got a question on pushing versus pulling. So Ellen Davis, one of our developmental pediatricians, says that she gets a lot further with schools if the schools request rather than you come from the outside. Actually, we experienced this, right? We went and talked to the superintendent. So talk about how we get into schools and whether you can motivate the schools to request the program as opposed to imposing it from the outside.
Yeah, this is a really good question. Schools are really overburdened with demands. So it's finding ways to speak to schools in ways that help them understand the value to them, because often they feel like things are being imposed on them. So for me, it helps that I was a teacher, because I can talk to them from that perspective, and I understand. So letting them know that there's value to them makes a big difference. And right now, this whole field of social emotional learning is coming on the forefront. In fact, the Department of Ed here in Virginia is just starting to develop standards, and I'm involved in that process, so that schools are going to have to adopt these programs of some sort soon, very soon. So if you can help them see that what you're doing aligns with their goals, it can really help. But you're right, it is hard. I find it hard every time I do these kinds of projects.
We'll just add a couple of things to that. One thing is, in Louisville, like, all the schools opted in. It wasn't centrally mandated. Schools had to decide, we want to opt in, so the level of the school administration. So that's one issue. A second one is that even after we discontinued the intervention and no longer funded it centrally, the school system itself took on the funding. And again, it was the school systems, the individual schools had to decide they wanted to continue and communicate that to the school administration. And so we've had really successful uptake where schools that were getting the intervention at their request wanted to continue doing it, and other schools that hadn't had the intervention, they were either the control group or weren't part of the study, have been asking as well. So in Louisville, we've seen a lot of uptake on that. And I think a large part of that is what Tish was talking about with this kind of whole school environment, that they see, oh, this isn't just people coming in and trying to force in their kind of favorite things into our school program, but they're really engaging with us as an organization and trying to understand our realities and bringing resources that span the spectrum from professional development for the faculty, for the teachers, to better school system support at the curricular level. And a final thing I think that's been important for this aspect is that we've focused on teachers in the system rather than just bringing in experts from outside that don't know anything about the Louisville school system or even necessarily public school education. And we've taken the approach of trying to bolster the capacity of the teachers who are already present in the school system, because they're the ones who are interacting with the kids throughout the school year, and they're the best advocates for the program overall.
I see another question from Joshua.
Yep.
How do you envision this being implemented in light of the pandemic? This are doing things now virtually, and we have a postdoc who worked with us last year, who is now just graduated with her PhD and now is working as a postdoc to create online modules. So we are making this available virtually. And that's another area where we have disparity, because there are kids that either don't have the resources to actually access virtual learning, or they have too many children in the class, in the home, to access enough tools to teach everybody. So that's just another challenge that we're all facing right now in the midst of this pandemic.
Excellent. Well, that was a fantastic presentation. Thanks so much to both of you for taking the time and for your commitment to children, and for being willing to work with us in the Children's Hospital and the department. I'm applauding here in my office. I'm sure everyone else is applauding on their own. So yeah, I just don't see any other questions. So thank you all. Thanks, Tish and David, very much. And thanks to everybody for attending.
It was really a pleasure, Jim.
Yeah, and thank you, Jim, for being so incredible to work with.